Hey guys, it's Dr. Sarah and Alicia. We are really excited today. We are talking about a super hot topic, cannabis in pregnancy and breastfeeding. So I'm lucky enough to have found an amazing expert in my colleague, Dr. Sarah, who has extra training in both women's health, but also addictions medicine. So Dr. Sarah, as part of her role, helps support pregnant women who are struggling with a history of or current substance use. So she is up to date on the latest and greatest when it comes to cannabis in pregnancy. So that's what we're going to talk about today. Top 10 questions around cannabis in pregnancy and breastfeeding. Let's get to it.
Welcome to the She Found Health podcast. We are Doctors Sarah and Alicia. We're maternity doctors who are passionate about caring for women and young families from conception through the first few challenging years of parenthood.
We have 5 kiddos between the two of us, so we get it. We've been there. And we made it through to the other side, and now we want to support you through your journey.
We are delving deep into topics to prepare you to have the healthiest pregnancy possible, the best birth you can, and to thrive rather than just survive during the newborn and postpartum phase.
We want to remind you that the information that we share is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information we share may not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.
Oh yeah, I'm super excited to talk about this. Really, since the legalization of marijuana back in October of 2018, I feel like in my general practice, as well as in my addiction medicine that I do, we're getting more and more questions about the safety of using marijuana in pregnancy and postpartum. So today we're going to answer the top 10 questions that we get as maternity physicians about marijuana use in pregnancy.
So if these are the types of topics that you're interested in, if you're pregnant, early postpartum, need high quality, good evidence-based information, make sure you subscribe to our channel below and hit the bell if you want notifications whenever we release new content. Also, check out our website at www.shefoundhealth.ca. We've got links to all kinds of great resources there. And let's get going. So our first question is, will using marijuana impact our ability to get pregnant?
So this is a great question and one we get a lot of. And I think to understand the answer, we need to understand that our body has its own what we call endocannabinoid system. So cannabinoids that we ingest, so ones from plants that are called phytocannabinoids, or synthetic cannabinoids like spice and bad kitty, are similar to but different than the cannabinoids that we make in our own body, which are called endocannabinoids. This system has receptors all throughout our nervous system, so throughout our brains, and also in our reproductive tissues. So you have to know that when you're ingesting cannabinoids that are external, they act on these receptors, and they act and our body responds to them really differently. So what happens is when our body makes our own cannabinoids, they make them, they use them, and they go away. When the ones that we ingest, they last for a lot longer. So they're acting on those receptors longer than our body would typically expect. And these receptors in the reproductive tissues actually have some adverse or negative effects when exposed to cannabinoids that are coming from outside the body. So that's from plants, so smoking and marijuana and ingesting edibles, as well as those synthetic ones like spice, bad kitty, the ones that you would be buying that are less commonly used these days. So these cannabinoids act on what's called the HPO axis, which is all the system that regulates ovulation. So we know that in women who use regular cannabis, that their ovulation can often be inhibited, meaning that you're not ovulating every month.
And what would you describe as regular cannabis use?
So we would say regular cannabis use is 3 or more times per week. That's what we consider a regular cannabis user. And I think Dr. Alicia can tell you, if you don't ovulate, you're not going to get pregnant. It's also found in the reproductive tissues in males, so it can impact sperm quality and count as well. And so, studies have been done and they show, interestingly, that time to pregnancy is not impacted. But we know that if you're really striving for fertility, it can be stressful, especially if you're starting later in life. We know definitely that it's not going to improve your ability to get pregnant. So we would recommend abstaining from cannabis if you're trying to get pregnant.
And Dr. Sarah and one of our local fertility specialists, male fertility specialists, actually did a podcast on this. So we'll make sure we link that in the show notes below.
Mm-hmm.
And we actually talk about cannabis use in our Preparing for a Pregnancy guide. So if you haven't gotten pregnant yet, you're trying to conceive, or you're in those early stages of pregnancy, please check it out. It's a free download guide, kind of helps you optimize your health to get off to the best start. So we'll link that in the show notes below. Check that out. So question number 2. Is marijuana safe for use in nausea and vomiting of pregnancy? This is a big question because nausea and vomiting is really common in those early stages of pregnancy. And oftentimes women actually haven't even seen their care provider yet when they're starting to get those symptoms. So I'm really curious to hear what Dr. Sarah has to say about this.
So we generally recommend avoid using cannabis in pregnancy because there's really limited safety evidence, and there's some good evidence out there of harms related to cannabis use in pregnancy that we'll discuss a little bit later. And the thing is that there's so many studies showing the safety of other options that we have to manage nausea and vomiting. There's lots of safe herbal products that you can use, and people really like natural. We have to remember that natural doesn't always mean safe, but we can recommend which natural products are safe, like ginger, vitamin B6, some medications like antihistamines like Gravol, Diclectin, and there's lots of other medications as well that have been really well studied that are effective for nausea and vomiting. And there's also lots of non-medical options. We actually did a podcast all about this, managing nausea and vomiting in pregnancy, and we went really into detail. So we can link that one below. And I think something important to know that not everybody understands is that there's actually a syndrome, and it's called Cannabis Hyperemesis syndrome, and it can actually contribute to and worsen nausea and vomiting. And we can see this in early pregnancy, and it can really complicate the picture. And so what happens with this is that people who ingest cannabis regularly, and that can be typically 3 times or more per week, sometimes even once or twice a week, it can increase it depending on what kind of cannabis you're using. And people get really nauseous, vomiting a lot, and what makes them feel best is a hot shower. So if you have symptoms like that and you're a cannabis user, you need to reach out to your care provider for help. We can help improve the symptoms, and the treatment is to stop using cannabis.
I've actually had a couple of patients with this in the past few years, and it's amazing the difference it makes once they stop using the cannabis.
Oh yeah, and they're sick. They need to come to hospital. They're so dehydrated. They've got electrolyte abnormalities. Oftentimes people need hospitalization when they have this syndrome.
Yeah. Interesting about the hot showers. I did not know that, though.
Oh yeah. So if you use cannabis, you get a lot of nausea and vomiting, and hot shower make you feel better, you've probably got cannabis hyperemesis syndrome.
So question number 3. Is marijuana safe in lower doses in pregnancy?
So, this is a question we get a lot of. Well, if I just cut back my use, is that safer? And unfortunately, the answer is probably not. So, in pregnancy, there's not often a lot of well-done studies because it's not often ethical to expose newborns to substances that we know have potential for harm. What we do know is that the endocannabinoid system that we talked about before, so all those receptors that are in your brain and in your reproductive tissues, are there from very early on in pregnancy. So as early as, the early 2nd trimester, and that they play a really important role in the brain development of your fetus. We also know that there's cannabinoid receptors on the placenta, and we know that THC crosses the placenta. There have been some studies show the levels in the plasma, the blood of the fetus, are at least 10% of maternal levels, and probably higher when people are using more frequently. And although we don't have any, studies that have given moms cannabis and then seen the outcome, there's some long-term studies, some of which have been running since the 70s, that are following babies that were exposed to cannabis in utero over time to see the impact on their growth and development. And what we do know is that cannabis exposure in utero is associated with low birth weight. There have been some studies that have shown decreased motor development at 1 year of age. So that means things like, sitting on their own, crawling, walking, being able to use their pincer grasp. All these types of developmental milestones can be delayed. And not tons of evidence, but there's some to point to it. It's a really complex body of literature because oftentimes people who are using cannabis are not just using it in isolation. They can be using cigarettes or other substances. So it's hard to sort of nuance out. But, the studies that have followed them over time have shown, it points to what we call neurocognitive developmental deficits. So this is things like impaired memory, ability to, verbally communicate, perceptual skills, and even verbal and visual reasoning. So the thing that we can tell you is that there is no benefit to using cannabis in pregnancy, and there's some evidence of harm showing low birth weight, and then cognitive stuff later on in kids. So we generally recommend no dose is safe in pregnancy.
And I agree. We also practice a big harm reduction strategy. So we are true believers in harm reduction. So if you have been using daily and you're able to get that down to once a week instead, that is fantastic. If you can stop it, even better. But the less you can take, and this goes for any kind of substance use, any medication that we prescribe, anything, the lowest effective dose possible is the best dose.
Absolutely.
And so if you're using it for recreational reasons, get rid of it. If you're using it because you've tried all of these other things and it's the only thing that works for your nausea or your mood, then just use the least amount possible. But also recognize that you can try these other medications that we have good safety data on first. So it's a challenging topic for a lot of people, and a lot of people use marijuana medically speaking, but haven't necessarily tried other things. And so we encourage you to try other things that we have better safety data on in pregnancy, but certainly the least you can use, the better. So if you're not able to cut it out completely, don't feel like we're going to judge you. We just want you to be and your baby to be as safe as possible. So cut it down to the least amount that you can use that covers whatever symptoms you're using it for. And that is an amazing first step.
And, to build on that, a really important thing is to try and use the lowest THC percentage possible. I'll talk a little bit more about that later, but, and making sure, where you're getting it is a reputable source. And if you're smoking it, maybe shifting it to an alternative ingestion method, because smoking itself, it's just hard on your lungs, right? And there are some medical therapies that we can offer. Some women who have been smoking really high amounts to cut back, we end up giving them nabalone. We're getting into the complexities here, but like Alicia said, just know that we want to help, and harm reduction, right? If you can't quit, then we need to educate you about how to do it safely.
So the fourth question is, what about cannabis and breastfeeding?
Oh man, this is a big one, right? And a very hot topic, I would say. So I'm going to preface this by saying most of the studies have only been looking at THC. So when we talk about cannabis, we talk about THC, which is the psychoactive component, and CBD, cannabidiol, which is the anxiolytic, the one that helps with pain. And you need a little bit of both for them to be effective medically, but most of the studies have been just concerning the psychoactive, the THC component. So with that in mind, I'll tell you what we know about breastfeeding and cannabis. So we know that THC is present in breast milk and it passes through the infant. THC, all cannabinoids, are really highly lipophilic. This means they like to concentrate in fat, and we know that there's a lot of fat in breast milk. There's also a concern with people using high THC cannabis about their ability to parent while intoxicated. So that's something really important to consider if you're thinking about using cannabis when breastfeeding. If you're using high THC containing cannabis, you need to make sure that you have someone there that's able to look after your baby while you're intoxicated. It can reduce concentration and reaction time. We know that in chronic users, we see higher concentrations in breast milk. And if you think about it, it's just, if you're using cannabis chronically, it deposits in our fatty tissues as well. So you just have more being released into your bloodstream and more being released into your breast milk over time. So even when you're not using, there is THC present in your system. An important thing to know is a recent study was just done by a very well-known researcher in the breast milk field named Hale. And they looked at cannabis use in recreational users, because a lot of the studies initially were done on people who had sort of chronic regular use. And the question we get is more infrequent use, right? And so what they found, it is present in the breast milk. The highest concentrations are about 1 to 2 hours after use. And the THC content does fall off after that. It still is detectable at the 4-hour mark, but in a much lower concentration. So what we would recommend is, if you're wanting to use cannabis recreationally while breastfeeding, that you should wait at least 4 to 6 hours after ingesting before breastfeeding, But, we don't know what a safe exposure is, right? So we continue to advise against it, but knowing that if you're going to do it, like Alicia said, harm reduction, the safest way to do it is to wait. An important thing to know is that people who use more frequently, so at least 3 times per week, like we said, that THC builds up in the breast milk, and it can take weeks for it to really clear out of the breast milk. So with that in mind, we just advise for you to do what is best for your family and your baby with this information, knowing that breast milk is gold, right?
Yeah. And it's a similar conversation that we have with alcohol in breastfeeding as well. So we don't want you to pump and dump, but kind of limiting your baby's exposure as much as possible, because if you're having the psychoactive symptoms, so will your baby. And none of us would actually give our babies THC via the mouth. And so just being aware of that. So waiting until you breastfeed. So if you're within that 4 to 6 hour mark, giving them some pumped milk some time that you hadn't ingested, or using a bit of formula to top them up until you can breastfeed later is a great harm reduction method. And still allows for the occasional use if that is something that's really important to you. So the next question is, what if I use higher CBD to THC containing products?
So this is a great question. And I think it's important to understand a little bit about those ratios. So what we know from the evidence looking at people who are using marijuana for pain, and I do think that as studies go on, cannabinoids are going to prove to be really effective. We just don't know enough now to recommend them. But the evidence shows that the best effect for pain, you need THC there in a ratio of almost 1-to-1. So if it's working for you for pain, despite what the labeling says, I would suspect that there's a component of THC in there. And there actually have been some studies that have been done, and they take products from dispensaries and they compare the labeling, and then they analyze what's actually in them. And basically, there's no accuracy there.
That's horribly frightening.
I know. So that's just something I want people to know. You just can't rely on the labeling to know that you're truly getting CBD alone. And I think it's probably quite unlikely. If there are CBD alone products out there and they've been lab tested and proven, and you can see that, well, then that's a consideration to make. But we also don't know much about CBD and the effects in pregnancy and breastfeeding, and we'll talk about that in a little bit.
So we kind of talked a little bit about different ways of taking CBD orally, so as opposed to smoking it. So what about CBD oils?
So people who use oils typically dab them, put them under the tongue. And we have zero evidence here. We just don't know, right? We have no human studies. And there's really no studies that look at CBD alone in pregnancy. There is some bench science. So I did a little bit of PubMed lit searching around this because I wanted to give you guys the best information that we have. And there have been some animal studies that have been done looking at just CBD alone, so cannabidiol. And what they've shown is that it does pass from breast milk into infants. And there is some thought that it can impact neuroendocrine function in the developing fetus. So unfortunately, the bench science is sort of showing that CBD may not be generally safe in pregnancy, but this has not been shown in humans, and we don't have any evidence to know. So if you're a harm reduction person, take that information with a grain of salt. If you're very risk averse, then I would say I wouldn't recommend using it. What we do is say compare it to a new drug on the market, right? If there's a new drug out and there's no evidence in pregnant population, we would recommend abstaining until any evidence does come out. So with CBD alone, we would, as physicians, recommend the same thing, always with that caveat of harm reduction. We're not going to judge you or shame you if you're using. We're going to support you in whatever way we can.
Okay, next question. CBD helps my anxiety. Is it safe to keep using it? And I hear this a lot. It's the only thing that works for me. I have a puff before I go to bed and it helps me sleep. It slows down my brain. Otherwise, I'm up all night worrying. So we hear this a ton in our family practice and also in our pregnant population.
Yeah. So I think you guys are probably going to know what I'm going to say here is that we just don't know about the safety. And it's important to remember that we actually don't yet have studies to show that these products are what is labeled or that they're truly effective, right? I completely respect and understand when it's a product that is working well for you, but we just don't have the evidence to back that up, nor do we have the safety. And one thing that I think I always want to remind my patients and my colleagues is that we have lots of studies that show safe options for anxiety in pregnancy and breastfeeding. That includes medications and other treatment options that don't include medications that we know are totally safe in pregnancy and breastfeeding and come with very minimal risks that we can clearly outline for you.
And what I'd like to add to this, and this is has a very special place in both of our hearts, is if you're struggling with anxiety, if you're struggling with mood disorders coming into pregnancy or early pregnancy, ask for help. There are so many options out there that are learning skill sets that you can keep using for the rest of your life. So mindfulness, cognitive-based therapies, mindfulness-based stress reduction. These are skill sets that you can learn during your pregnant period that can help you immensely in the postpartum time, in the parenting time, through challenges in relationships, forever. And they have such long-lasting benefits, not only for you, but also for your little ones, both by showing them how to get those coping skills and manage stressors, but also in having those improved interactions with your baby because you just feel better. So that is a huge place we're coming from. We're not pushing medications. If you are not comfortable taking one of our antidepressants that we recommend, that's totally fine. But we would highly encourage you to seek out these other therapies that have tons of evidence behind them to help you both in the pregnant time but also long time as well. We actually have a really great mental health resource, so we'll post that in the link below. So if you're interested in getting kind of some basics around what's out there, especially in our community, but also some great online resources, check that out. So we'll post that below as well. So another question we often get is, what about topicals? So a lot of people use kind of topical CBD for pain, localized pain. So what about that?
So I think you guys can guess what I'm going to say here. CBD, we don't know, right? But what I do want you to know is that there is evidence that topical lotions are absorbed into the bloodstream, right? So, like with anxiety, there's other options for pain that we have that are like medications and other interventions. But know that if you are using topical CBD, it does get absorbed into the bloodstream. So you will get fetal exposure. And we just don't know the ultimate long-term effects that that's going to have. Right? I know. I feel like such a downer, you guys. I just want to give people information.
I know. And it's so tough. We just don't have the evidence to do it. And so it's tough for us to say, yeah, it's fine. It's probably fine.
I know.
Because if something bad happens, you're going to feel horrible.
I know.
And so that's where we are. And it's a tough place for everybody, for care providers, for patients. It's a challenging spot. So what about edibles?
Great question. So interesting that, there's tons of national studies that are done, and it shows that 40% of female users use edibles compared to 10% of males. So way more females are using edibles.
As opposed to smoking.
Exactly. And so what I think is important is to understand the way your body processes edibles compared to inhaled. So when you inhale cannabis or marijuana, the peak effect is generally seen after 10 to 30 minutes, and it lasts on average 2 to 3 hours. When you ingest, you don't see that peak effect for 2 to 4 hours, which is why sometimes in the work that I do in the hospital, you see people come in and they have overdosed on cannabinoids, right? Because they take an edible, 30 minutes later, they don't feel anything, so they take more and more, and then they hit that 2 to 4 hour mark, and things really take off. So be aware that when you ingest, you don't expect it to peak until 2 to 4 hours, and it lasts 4 to 6 plus hours. So when thinking about breastfeeding, for example, if you're going to use an inhalation, it doesn't last as long as those edibles. So keeping that in mind, and understanding again that it's really what we call highly lipophilic. So bound to really fatty tissues. So breast milk and your liver and your heart and your brain, and then your general fat. It takes anywhere from 2 to 60 hours for it to start to secrete from your system. And even a single use can still be seen in your urine up to 5 to 7 days later. So edibles definitely sticks in your, bloodstream a bit longer. And then to really get out of your system as it slowly sort of leaches out of that fat can take almost up to a week. So typically if you're going to use in breastfeeding, I would choose the inhalation method.
Or probably the drop.
Yeah.
The drop would have a quicker onset than the edible, slower than the inhalation, but be out of your system more quickly than the edible as well. Yeah. So that might be don't smoke, but the oil.
Yeah. And you can get vaporizers. So I'm not talking about the vaping pens, but you can get like a water vaporizer to ingest so you're not smoking it, but you're getting a much faster onset.
Okay, the last and my favorite, I think all of ours favorite, but it's natural. It must be safe. Now, we can go into so many things that are natural and not safe, like cyanide, death.
Taxicol. A bunch of chemotherapy drugs are from like the Pacific yew tree, right? Digoxin is from foxglove.
Yeah. So there's a lot of things out there that are natural that are not safe, and we know that.
Yeah, so, that's the big thing we say is, psilocybin, magic mushrooms, natural. We wouldn't recommend them in pregnancy. So take the consideration that natural doesn't always mean safe, especially when it comes to pregnancy and breastfeeding. We don't want to, put extra limitations on pregnant and, breastfeeding people. It's already a challenging enough time. We just want you to have the information and the understanding that just because something is natural doesn't mean that it's the safest option for you and your baby.
And also keep in mind that this is a relatively limited period of time. And so if you are able to cut down or decrease your use dramatically during this period of time when you're pregnant and caring for young infants, amazing. Again, a big component of postpartum use is that intoxication. And keeping in mind driving, and we say this with lack of sleep in postpartum too, right? We often don't talk about intoxication with lack of sleep. Same thing. You just got to be considerate of how mentally quick and astute you are when you're getting behind the wheel of a car, whether that's from lack of sleep, whether that's from alcohol, whether that's from THC. So just being aware of those things and kind of your parenting skills and all of those pieces to the puzzle. It's really important to kind of consider that when you're deciding on what or what not you're going to use in pregnancy and breastfeeding. So I know for some of you this is a really disappointing video.
I know.
We apologize.
Sorry to be such downers.
But really we do want to support evidence-based or lack of evidence, really in this case. And really information and making informed decisions is really important, and just decreasing the risk of harm. We tell people not to eat tuna in pregnancy. I mean, the risk of getting mercury poisoning is really small, but you'd feel pretty bad if you opted to eat it and went on to have complications with your pregnancy. So it's all about risk reduction in pregnancy, which we know is a bit of a bummer because a lot of the fun stuff we like to do, we can't do anymore. But it's a limited period of time in your life with long-lasting potential impacts on your baby. So that's why we kind of have these kind of bummer conversations, because we want you to make sure that you have all the information you need to make the decision that's right for you and your family, which is going to be different than somebody else, and that is fine. So thank you for listening. We'll link all of the stuff we chatted about below, our mental health resource, our preparing for pregnancy resource.
If you enjoyed listening, please head over to iTunes, subscribe so you don't miss any new episodes, and please leave us a review. If you found this helpful, take a screenshot and share on social to help other mamas access this information.
Check out our website at www.shefoundhealth.ca and join our community. We send out weekly emails and release new content focused on this incredible time in your lives. We'll also be sharing exclusive offers, so be sure not to miss out.